To a complex issue, no matter who you talk to. And there's no easy solution to this one. But tonight, numbers that illustrate part of the problem of homelessness in the valley. ABC 15's Fort Hatchett participated in that actual count that happened back in January. He joins me now with the results of this. I've always wanted to take part in it. Such an interesting thing. You were there for it.
Yeah, it was bright and early in the morning. And what's telling is those numbers look very similar to what we saw, at least in the total count last year. But, when you dig into the numbers a little bit more, you'll see that there is some change. There's still more than 9,000 people living without housing on the street, even after that 2023 cleanup of the homeless encampment known as the Zone. And if you take a closer look into the numbers and kind of dive in, you'll discover that 57% of the people experiencing homelessness, at least those who were encountered, are in some sort of transitional housing or emergency shelter right now. Last year, that number was just 49%, so a little bit lower. And again, we were out on the street with crews conducting this count in January, and they were very forthright with us. I said this wasn't the most reliable metric. It's literally people going around and counting folks by hand that you see on the street. But as unscientific as it may feel, it is a requirement from the federal government and one they use a lot.
Right now, we are not getting our fair share of federal resources. Phoenix is larger than Philadelphia, but Philadelphia gets 3 times as many housing vouchers as we do. So we're going to take this data and try to get more of your tax dollars back to Phoenix.
And Katie, one of the stats that really stood out when you really get diving in these numbers, and there's a lot there, is that at least 25% of the homeless population living in Maricopa County suffers from some sort of mental illness.
Yeah, it makes you realize how much that resource is needed too. You've been covering so many different aspects of this. I know you also had a chance to look at the health care for those who are experiencing homelessness. What did you find there?
Yeah, Katie, I did. And obviously it's not a traditional doctor's office somebody is walking into, right? It's really a group of people in a big truck traveling around the valley, working to find folks who need help wherever they are. And right now we're going to show you some of these community heroes working to make sure that everyone can get the care they deserve.
How long have you had that swelling in your knee?
For like 2 weeks.
Rachel first saw the Circle the City mobile health unit team about 6 months ago.
Quite a bit of our patients are not able to see doctors unless we go out and find them.
On this day, they accommodated her and her dog, Bo.
It makes you feel like that they really do care about you.
Circle the City has 5 mobile units and 3 street teams.
This is part of the reasons I became a doctor.
Working across the valley to treat the homeless population who may otherwise not receive medical care.
It doesn't matter where you are, you can find that help. Is that right?
Yeah, it could be out in the desert and they'd be out there, out of nowhere, they'll still take you.
The team is ready to help care for whatever walks to their truck.
I get migraine headaches.
It's got to be hard sometimes to find.
Good help for HIV tests and stuff, and especially when you're homeless. So this is pretty good.
Hoping to treat patients who otherwise may not seek out or be able to afford care.
Patients out here are vulnerable. A lot of them have underlying medical conditions, and that's what this organization's about, is reaching them.
Rachel and Bo were happy to see the Circle the City truck. Rachel dealing with heart failure and preparing for an upcoming surgery.
Because of my situation being homeless and I can't be on the street after being
For sure. We have a respite center, which would be a great place for you to go.
because they help you with pre-prep surgery.
Yes.
The kindness and dignity in her care putting Rachel at ease.
When you come to Circle of the City, it makes you feel a lot more like they care.
During the summer, the medical team says they see more cases of dehydration, contact burns, and heat stroke, making the mobile health teams vital.
If you don't take care of your health, you could die, especially in Arizona. So yeah, you've got to be real careful, and you got to make sure your health is secure and taken care of, because you could die out here.
It's not safe out there, I feel safe in here.
Absolutely essential care right there. Thank you, Ford. There are resources available to those who are living on the streets, including several shelter facilities like CAS that provide emergency shelters, eviction prevention, employment training, so much more. 211 Arizona can also connect people to shelter services, affordable housing, rental assistance, and more. By the way, when it comes to rental and housing assistance, the City of Phoenix provides emergency housing help along with the Arizona Department of Housing, which has resources that stretch all across the state.